Well, thank you very much for staying, and I'm sure you may be jigging in your bed or jigging while you're having your coffee in the morning. It's countdown to Christmas, and we are sort of loosening it down a bit because the heat will be all up back in January, and you wouldn't even think that you went through 2015. So let's end it, with very lightly. Let me just read this comment here on WhatsApp. And no, I missed it. Okay, this one. It says, I'm a Liberian. I monitor Joy News and other shows such as Big Story, News File, etc. I like how the host and guests discuss vital issues pertaining to Ghana and Africa. Merry Christmas and Happy New Year to Joy FM and Joy TV family. Oliver Freddy Wilson. Oliver, thank you for watching. And then Nana Kwejo Efa, you sent in us a message from Tepa. Happy birthday to you. So if Nana Kwejo Efa is your friend and you live within the Tepa area in the Ashanti region, send him a well wishes from us and from you too. Folks, there are many people who get stranded or are detained at the various health facilities because they are unable to pay their medical bills. Access to healthcare appears to be a luxury for many people who can afford it. But is there a way to help people who cannot afford to pay all their bills get access to healthcare and then probably, pay later? The Korle Bu Teaching Hospital has started an initiative which will make it easier for needy persons to be able to have access to essential health care. Now, I'm going to play a documentary, but when I come back, joining me to talk about this will be if you roll it for me, please, thank you, will be Dr. Samuel Esiama and the PRO for the hospital, Mustafa Salifu. We'll watch the documentary, and then when we come back, we'll set out the precedents. And I was having a chat just before, and you will be shocked what's happening. Stay tuned.
Imagine being sent to a hospital with a bleeding accident wound and asked to pay before a doctor attends to you. You may die. Many have died for the simple reason that there was no money around to make the required advanced payments in similar cases. So in 2004, the government of Ghana started implementing a National Health Insurance Scheme, NHIS, to remove costs as a barrier to access quality healthcare. This changed the healthcare system significantly and had far-reaching consequences for healthcare providers.
It wasn't easy giving care for cash and carry. At times, you give the treatment, the client comes and tells you that I don't have money. Then at times even they will bring their clothes, collect this and then let me go. If I get the money, I'll come and collect the clothes. Some bring beads and all those things. And I saw that, in fact, in the area, they are all peasant farmers. And a few are traders. So they don't have much income. And it has been a problem for them that they can't pay for their hospital bills. So I thought it is going to relieve both the clients and myself.
When the health insurance scheme was introduced, it's led to a remarkable growth in the number of people seeking care from the maternity home. During the first few years after being contracted by the National Health Insurance Scheme, the scheme reimbursed her facility on time, resulting in an increase in the income level of the maternity home.
It was very smooth because I could pay my workers, and I could buy my drugs, pay for my utilities, and do other things. That has even helped me to be able to put up a stand maternity home because I was not having the administration block. I was not having the storeroom, and I was not having records room. Also, I couldn't, though I provided water for the clients, it wasn't regular. It wasn't on a regular basis. But then I was able to provide all these things.
Another health facility is the Pentecost Hospital. It serves as the municipal hospital for the La Nkwantanan Medina municipality in the Greater Accra region. 80% of its clients are registered with the National Health Insurance Scheme.
When we were running the 5 facilities with a cash and carry system, people were detained, some could not pay, and as a facility, some people also absconded because they could not pay. So before you realize they've absconded from your facility with your money. So the expectation was that this project or intervention is coming to help us.
During the first few years after the facility was accredited to provide services under the health insurance scheme, the hospital expanded its facilities and employed more nurses, doctors, and other healthcare providers because payment of claims by the NHIS was very regular. Generally, expectations and experiences of healthcare providers with the NHIS were positive.
I remember when we started operations, we hadn't gotten the accreditation yet, and so it was basically cash and carry. And to interest you to know, you come in here, and you have sometimes the whole day 5 people. Sometimes come and sit there the whole day, you have less than 10 people. And the very day we got accreditation, and then we posted the notice that the place is now NHIS accredited. Then the numbers from nowhere started going up, and it increased from 2050 up to now. I'm talking about a daily attendance of 120, sometimes 150.
In November 2013, about 10 years after its inception, the NHIS was named the most efficient health insurance scheme in West Africa by the Security Watch Africa. And
Well, thank you very much for staying, but we're here to look at the Critical Health Fund. Even though you're watching the documentary about the NHIS, it continues and then it goes into the Critical Health Fund, but, eager to hear what the issue is. Critical Health Fund, exactly what it is. With me in the studio, the Director of Medical Affairs at Korle Bu, Dr. Samuel Siama, and also the PRO, Mustafa Salifu. Oh, Mustafa and I go quite back.
Yes.
Gentlemen, you're welcome.
Thank you very much.
But look, before we go into the Critical Health Fund, Korle Bu is back in the news again. Now, Mustafa, you're the PRO. The perception or the relation between Korle Bu and us, is it us media painting it that black, or it is really black?
Yeah, I think there are instances where people have interfaced the hospital, and they've actually come back with feedback that sometimes when you compare with what the media actually carry, then you begin to wonder what is happening. I think the media, some of us, we try to thrive on controversy. So wherever there's even a little scintilla of something that's not going on well, the kind of dimension and then the coverage that they give it, they tend to actually distort the situation. And I think that it's just the media that is looking for bad news. When they get the slightest incidence of something that is not going on well, then they blow it up. Sometimes there are instances when you even call reporters and say, oh, we are doing a new procedure, we are doing a new surgery. Oh, you come and then see how it's going. They are not interested, but you say that
when needles are finished,
exactly, or a lift is not working, then all the media houses will descend on us just to carry the story and not even to say that, oh, how do we help you to support to resolve the problem? We know it's not their business to do that, but I think elsewhere the media are usually out to look for solutions to problems that are confronting. Because ultimately, the essence of whatever story that you carry out is to help the society. So well, if we hammer more on the negativity, I think sometimes it has so much. I'm sure the recent happenings.
You think that we push, maybe we overblow the bad ones and sort of not tell the good stories too much?
I think that is
Maybe the situation is
sadly-
not perfect, but we are making it worse by our
Exactly.
stories.
Exactly.
I don't know. I'm just sort of probing to find out, because I asked this morning anybody in here who's ever been to Kolebu for treatment. None. Cameramen, directors, nobody's ever been there for treatment. So all they know is what they read in the paper or what some auntie went there and came to say, but nobody has had a personal experience.
I think, let me, if I can cite this example, it was somewhere in 2006. There was somebody working with the Nigerian Television Authority. The person needed to do undergo a procedure at the neurosurgery unit. In fact, they were contemplating sending the person to the UK for that. But then they decided ultimately that they will bring the person to Kolebu after they had done their background investigations, and then it came up that the procedure could be done in Kolebu. They came, the procedure was done successfully. This lady went, and they came back with the entire crew to do a story for their viewers in Nigeria. They were happy with the results.
Wow.
There's also another incident that happened in 2012. This Reverend Father Campbell. He came to Kolebu and then had a surgery done for him. In fact, options were given him from Rome that he could go to choose any hospital outside Ghana, in the UK, and the US. But he said, he was going to do the surgery in Kolebu. And the surgery went successfully. He was so happy, he wrote in the graphic thanking the
So they are good stories.
They are good stories. They are good stories, but the media are not sometimes interested in these things.
Let me gloat and say that all these stories were not coming from the first floor maternity ward. There are no bad stories coming.
even look at that. Look at that. When through your instrumentality we got the first floor. In fact, that used to be one of the wards that you would not like to stay in for a day. But you converted it. But look at the way the coverage was done. And I think it's something that we should have blown out of proportion for other companies to look at it and then get attracted to also come and help.
Well,
we know it's the responsibility of government to provide for Kolebu Teaching Hospital, but government cannot do it all. So we need corporate bodies, just like what you did, and others, so that they can come and support. After all,
let's commend
as they always say, Kolebu is the last stop, whether we like it or not. Because you can go to all the fine private facilities, but when it gets critical, you ultimately be referred to Kolebu Teaching Hospital.
Wow. Let's say a big thank you to Imperial Charity Foundation, who the money behind the refurbishment of the first floor of Kolebu, and indeed they did a fine job. So Imperial Homes and Imperial Charity Foundation, we say thank you very much. But let me speak to Dr. Siama. Dr. Siama, I want you to explain Critical Health Fund, because yesterday, as soon as we talked about Health Fund, everybody was thinking NHIS, and I'm saying no. There's a different one. So I don't think it's quite out there. If you can explain to us what the Critical Health Fund is.
Well, thank you very much. The if you like, the heading or caption is actually Critical Care. Critical Care Fund, and it's actually localized in Kolebu. If it will be made national someday, that's fine. But currently, it was born out of a very serious need and an observation. Just as PRO was saying, only the negative stories go out there. But nobody is taking pains to understand how practitioners actually work in the place. Sometimes, for want of a better word, Kolebu becomes more like a dumping ground, or people may go around many places, health facilities, and when their money is about finished, go to Kolebu. When the case is serious, go to Kolebu. So they land in Kolebu virtually penniless. Others are brought in unconscious. They may have all the money in the world, but probably not accompanied by anybody else. So the critical areas, if you like, for the general public, the emergency areas, like coming to the surgical medical emergency, coming to the trauma area, which is the accident and orthopedic center, the pregnant women who are coming in very bad states, the children who are almost dying, either to the neonatal intensive care unit or to the babies unit, or even somebody with a serious surgical condition that's been brought in. In fact, the recent happening, the June 3rd thing, all such cases come through And I can tell you, quite a number of them do not have the money immediately to pay. And trust me, in spite of the NHIS, some of these items are so capital intensive to the extent that insurance is unable to cover all. So somebody has to do that money to pay for the service.
Before?
Yes, because you need to buy some other things. There are some things that are not covered. They have specialized, Korle Bu is a tertiary institution. Some catheters, some medication are way above the threshold. These are not stories you hear from anywhere, and yet the patient needs that to survive. If that is provided immediately, it's like magic. It happens. Yeah, well. So the first few minutes or hours of the patient in the hospital is critical to the outcome. If you're able to solve that, we have the best outcome.
Are you saying that if somebody was in a taxi and it rolled over 3-4 times today and they turn up at the emergency with no ID because they haven't got a phone or wallet or anything, and they needed some surgery done, the surgery can be done?
That is a tall order. There's about so much that the hospital can provide, but if you move to another arena, somebody ought to go and buy that medication. Because you see, we don't have unlimited resources. Many people come through. So let's just say we have this whole studio full of IV fluids. By the 100th person or something like that, it will be finished. Who is replenishing that? Nothing. So the thing is, we are always in need of resources for cases like that. And there are many such that come in every day. So the thinking was, how do we solve this problem? Those who come in critically, they may be rich, but we don't know who they are, and sometimes unconscious. They don't have the money to pay immediately, but if you have the resources, you save their lives. Once they are up, they readily will pay and move out.
Wow.
But once you don't have any back, out there in advanced world, they have various levels of insurance, and so things run. Our insurance has its limits. And when we come to the tertiary facility, seriously, if you go to a case like the intensive care unit, every little thing there is imported. We are talking about Forex here. And now you know how the city is misbehaving. So the costs, even to be in an ICU for a day, we are talking about 1,000 to about 1,005 Ghana cedis.
A day?
A day. And if you have to go on a ventilator, that's another nightmare. So management thought of it and said, why? We'll have to.
If you're talking 1,000, 1,005 a day, I mean, even those of us working, we probably after 6 hours, you have to say, well, your time is up.
That's precisely the issue. So rather than go out there and make noise, we think we have some solution.
But are there no state funds or anywhere that looks after this?
Your guess is as good as mine. So everybody may think that the insurance will be enough to sort things like this out. If we have many of such ICUs even in Ghana, I'm sure that will be one area that the insurance will collapse immediately, because you need so much to keep people alive. That is why, in fact, it is a good thinking that you talk about preventive. Have it, people may still pass through and come in the worst states are possible, and they don't have the money to pay for it, especially the pregnant women and people who come in burns like that. Probably the whole home is burnt or whatever, wherever they're coming from. They have nothing on them, and you need to save their lives the first few hours. Once you're able to do it, in fact, the people leave the hospital with joy, and you are satisfied as a practitioner.
So all these years, what have we been doing? I mean, how have we been coping? Is it a conveyor belt business that we condemn?
I just it's something I don't want to get into.
Wow, that's frightening.
Some of us park our vehicle across the emergency room, and every day that you pass, you see the pain people go through. So you cannot but to say, what can I do about this? And now that I'm also in management, even more so, I cannot just look on. So this thing was raised at management, and they said, no, let's do something about this. And hence the idea of the critical care fund, where we are asking Ghanaians to help build that, and there'll be a team committee that looks after it. Thankfully, the Fidelity Bank want to partner us. In fact, they have partnered us, and they are using all their branches countrywide to solicit on our behalf. So we need others to also help grow the fund, so that you may be the richest person, you may be driving your Ferrari up country somewhere and then you are involved in an accident. When you are pulled and you are brought there, nobody knows who you are.
Wow.
This fund will take care of you until you come back to life.
Mustafa, now this is a very frightening conversation for as we go to the end of the year. But you see, we are even talking, assuming that everybody can afford it if we identify who they are. I mean, 1,500, I'm sure about 90% of the population may not be able to stay in a hospital a week if it's 1,000 cedis a day. So, assuming those who come and they have all their IDs, their mothers and fathers, but they can't afford it, what then happens?
That has been the experience for some time now. When they come as health workers, the preoccupation is to save life. So what you do is to go ahead and pump in the little resources that you have just to save the life of the person, with the hope that it may be somebody who will be able to settle the bill afterwards. There are instances where you can invest as much as 70,000, 80,000 on one patient, just to discover that the person is a pauper, the person cannot pay. So that is a bill that the hospital is saddled with. And at the moment, I'm sure the debt that we incurred through these ICU services is in the region of 700,000 Ghana cedis.
Yeah.
700,000 Ghana cedis. And we thought that...
So you have to pay the vendors who supplied the
exactly
devices that you used.
And it's something like bad debt to the hospital. And we can continue this way if we want to maintain the service. And as Director mentioned, we are going to increase the number of ICU
beds.
Beds
we used to have 4 beds. Now we are heading to 40 beds. So now 4 beds is we are incurring
so 700,000 on 4 beds.
So now you are moving to 40. You can understand what is happening.
So it's actually something that we all need to support, so that we can save towards our future, because you never know who will need this service.
I hear people coming with like beads and plantain to say, look, this is what I have.
Yeah, when they finish, that is a common place in the districts. Mm-hmm. In Accra, they'll plainly tell you, I don't have the money. Pure and simple. They just don't have them.
And they don't lie.
No, they don't have it.
But actually, there is a system in the hospital where we do background checks on patients who cannot pay. We have the social welfare unit. They will do background checks, they do background investigations to actually establish whether or not this patient can pay or truly cannot pay. And when it's like that, then you have to submit a report to management for them to take a decision.
Let me ask a silly question, but let's say, I mean, they don't have physically maybe 70,000, but maybe they have an old taxi which is worth maybe 20,000. I mean, can you take the taxi from him and say, look, I'm selling your car to offset your medical bill? I mean, is there any...
Then we are pushing us into an ethical area. Here's the deal. The system is, for those we identify don't have the means immediately, there are actually 2 categories, if you like, or maybe 3. There are those who don't have the money now. Mm-hmm. But if you give them time, they may be able to pay
over a period.
By installments. And so social welfare will have to go into their bag and go to their homes, see the family members, see what is going on there. And they can advise the hospital, they don't have the means now, but it appears if you give them some number of months or weeks, they'll be able to pay you. And so they arrange with them, and then they can tell, okay, every month I'll bring in, say, this amount. And then there are those, in fact, you end up, and it happens most of the time even in the hospital, without the critical care fund, doctors and nurses, right during the ward run, everybody will put their hands in their pocket to buy medicine to keep somebody alive right there, because they want the person to be well so they can go home. And some wouldn't even go because free bed, free meal thereafter. Yes, because they can't pay. You've taken care of them, they can't pay their bill, and then they stay on. So
you have water running, and then you have all the facilities.
So you
Yeah.
can do it at least squeeze
yes.
2 more
Yeah,
days. Let me just chill 2
relatively
more days.
no doom so.
You see now?
They are enjoying the electricity, the free bed, free food. That's the
Doctors at hand, nurses at hand. Why
Yes.
should I go?
Exactly.
yeah.
How long was this thing start? This critical care? fund?
Yes.
It was actually 25th of November that
Yes, we launched.
launched.
we
Okay,
launched it
okay.
Because the situation is getting alarming, and we are getting many more ICUs on board now. And we realize if we don't put a system in place to maintain the service, we'll open all these new beds of ICU and critical care, and the service can't run some few months down the line.
So what's the idea? Every Ghanaian should pay something towards
Every
it.
Ghanaian.
Is there a quota like pay 1 cedi, 2 cedis, or?
I am from a background where we respect even persuades. So whatever anybody has, if this idea sinks in deeper and you believe in this and you bring the health of the Ghanaian, your little and your much, we want them all, from the peswa to the millions.
Is there any way, and I don't know how, that you can put confidence in the public that somebody says, I swear to God, as for this fund, it will be managed properly? You see, because everything else, there's always something about the money. You know, somebody will even say, why should I give you this when they are branding a bus for 3 million? You know, you don't, and I mean, this is 700,000. I mean, that 3 million could have paid all Ghana's debt. Everybody says, oh, this, and they branded a bus for that. You know, so there's always something. Is there a marketing or a PR machinery to really assure people that, listen, the Pope is going to look after the money, you know, Mary Magdalene is going to disperse it, Jesus Christ is going to be administering, you know, something so that we put our money there?
Well, if there's any comfort, we are in partnership with Fidelity Bank.
Okay.
They are using their branches countrywide, and they are the ones helping us to grow the fund.
Okay.
So in terms of the safety of it, that's the other bit. But to be able to source funds from there, there's a committee in place that looks at, in fact, we've set a criteria for those who are qualified to access a fund like that. So that is pre-qualification. It exists there in the emergency area. So as soon as they realize that this particular patient that are coming fits the criteria, they are.
But in that case, everybody fits, isn't it? I mean, in the ICU, everybody fits the criteria, because you just need to treat them. Oh, so after treatment, after whether you pay or you walk away.
Exactly the point.
Okay.
Exactly
okay,
the point.
Okay.
For those who don't have immediately, the fund will have to have, if you like, a bit of it easily available for some things to run. But if we are entering into certain thresholds, committee will look at it and assess. But the idea is that it's not necessarily a freebie where you come, you get it, and you walk away. That's not what we are preaching, because otherwise it will all be depleted and we are back to square one.
So, you see, realistically, 1,000 to 1,500 a day from Savelugu to Axim. How many people in this Ghana today, that a day, they have 1,500 to say, yep, doctor, today is Monday, Tuesday, take another 1,500 and put me on the ventilator. I mean, how everybody, 98% of us would fit the bill.
In fact, you mentioned the figure. The bed occupancy in the place is 99%.
Wow.
Plus. Yeah.
Constant.
So it's as if you're looking into the crystal ball. That is exactly what it is. So, but the good news is that if we are able to start the treatment early enough, they may not stay longer in the ICU and cost is reduced. The same way you hit the emergency room and we identify this case needs an ICU care. Sometimes you're sent there a day or two, you're fine, you're out. But because of these constraints, you may be kept in an emergency room, waiting for how can we get this person into the area. By the time you actually go into the ICU, it may be too late, or it means we are going to get more costs. So the fund in itself, if you critically look at it, if the long term will actually help reduce health costs, because you are able to solve the problem even before it gets worse. It's brought in, it's critically ill. You can put in measure because resources are there to do it immediately. And the same day the person can be well and is home. Even if he cannot pay, he's going home, less costs. But he can't pay, you keep him on, it gets worse. You have to have more money, more resources to treat the same case.
At the moment, if you want to pay, you have to walk into a Fidelity bank and then pay money, or?
That is one area. We have other means, I'm sure Mustafa will talk to you about.
Yes, just not only Fidelity. Anybody, we recognize that people may not have the time to walk into any Fidelity branch to make payments. So we came up with this idea that people could pay through mobile money. If I'm on MTN mobile money, Airtel mobile money, we are getting the other service providers as well.
This mobile money, and they're going to take too much percentage from your money. Have they agreed to, because of the nature of the fund, let you have it, or they're also in there trying to milk their part?
Yeah, for now, when we were doing it initially, we said, oh, there was a need for us to have discussions with them so that we talk about as a way of also giving back or supporting the fund, so that if they could waive the percentages when you are donating to that fund. But we've not had concluded those discussions yet. For now, they will still take the percentages that the going rate for anybody using the mobile money service.
But what's the number anyway? Because as the year ends, I bet everybody just one with the 1 CD crowd, send the brand.
Exactly.
Something small. You top up your phone by 5 CDs. Just
Just give 1 CD.
Just transfer 1 CD. Maybe 1 CD 20 pesos, so that when they take their 20 pesos, the 1 CD stays in the fund. This is a serious issue.
Yeah, for the numbers, the MTN is 0554 871 629. And for the Airtel is 0261 065 017. So if you just take your phone now, you can donate into the fund through these numbers.
So the MTN is 0554
Yes.
871
Yes.
629, and that's for MTN. Yes. And then for Airtel is 0261 065 017.
Exactly.
For Airtel. Now, you see, as Ghanaians, we've grown out to this attitude, say, until I get to ICU, it's not my problem, it's their problem. So if you could, this is just my plea, if you can ask some of the family members, if they don't mind their patient being videoed, so we can actually see the graphic nature in which people go through and what could have saved them and what could have killed them. Maybe it would ginger us, but I hope that the producers you bring you also will talk about this thing again, because in theory what they are telling us is that it's a conveyor belt. Once you go in there and you don't look like somebody who has 1,500 cities, well, what a man more pain from Kakra. When he goes, he goes. Because the doctor also hasn't got that 1,500 to treat everybody. Okay.
There's another way of, for those who love the internet, there's also a website, www.fundraisingafrica.com. Those who want to use their MasterCard and Visa card, you can also pay through that means.
www.fundraisingafrica.com.
If you use your Visa or MasterCard, they all head to the fund and it's going to Fidelity.
Well, gentlemen, on that scary, I mean, did you want to end with anything? Is there anything you wanted to end with before?
I don't know. There was a documentary, and I'm wondering if that
I will see if they can play. We have it, don't we?
Yes.
So I'll speak to them, and then I'm sure somewhere in there they will play it, and hopefully we'll see some graphic things that will bring us reality. But what keeps coming back to me is that at the moment, anybody who comes in there is sort of a 90% death sentence.
Yes.
Unless you have the means to pay.
Yes.
and the rate at which accidents are coming to Christmas, I think we
You
should
have
all
no idea.
we should all do our bit. But gentlemen, thank you very much for shedding this scary light onto this scary topic. You and I, it's our responsibility to just, every time you top up your phone, MTN 0554 871 629. Just send something there. And then Airtel is 0261 065 017 or
fundraisingafrica.com. Use
and
your
put
Master or
something in
Visa
there.
card.
Because you never know when your cousin, yourself, anyone at all could end up in Kolebu and need help. But there's more to come. Oheneyire has got a surprise guest, and they're going to be talking about really, really interesting stuff. Yesterday was Ochiame Kwame, and it was fantastic. Today is even going to be mind-blowing. So don't move. Stay tuned. We're coming straight back. Thank you.